I came to Lancaster in 1981. At that time, I wanted to change from being in academic medicine to a private practice of neurosurgery, and I got acquainted with the neurosurgeons here in Lancaster, and they offered me to join them, and that's how I made the decision to come to Lancaster, which I've been very happy to be here for 30 years. Lancaster is fortunate to have excellent medical care. I think our medical staff, nursing care, hospitals are first class. And I think people in Lancaster should be proud of the medical community, and they're lucky to be living in this area. Well, when I was finishing high school, I was thinking about what I was going to do with my life, and when I look at all the choices that are out there, I couldn't think about any other profession other than become a doctor. And when I became a doctor, as I was going through my medical training, I was influenced by a neurosurgeon that was one of my teachers, and probably that was one of the big reasons why I became a neurosurgeon. The thing that really makes me to enjoy what I do and feel good about my profession is to get good outcomes for patients. I do a difficult brain procedure, and then to be able to see that this person does very well and goes back to a normal life. That's the most rewarding thing of this profession. Well, the thing that I always keep in mind every time that I'm involved with patient care is to be able to dedicate enough time to the patient, to be able to listen to the patient complain, and to when I'm doing surgery, I take whatever time is necessary to be able to do the proper procedure and without hurrying, so to try to get the best outcome possible for the patient. That's always foremost in my mind. I always remember a patient that I had some years ago that had a ruptured aneurysm that I did surgery on him. And this man was in a coma for many weeks. Nobody thought that he was ever going to be able to recover, but we were able to persist in his care and be aggressive. And eventually, he made a full recovery and went back to work as a truck driver, which was remarkable. So that case always sticks in my mind. Well, normally I try to emphasize to the patient whenever I had the opportunity to remind them to lose weight, to stay in good physical condition, to exercise regularly, and to have some common sense about eating habits, and not to smoke, and not to use too much alcohol. All those things are good for everybody, and that will help them to prevent them problems with their back and their spine. So that's always try to remind this to the patient. Well, when I'm not performing or involved in neurosurgery, I do like to be physically active, and I jog regularly. In the winter time, I like to go skiing, and I play tennis. Maybe not as much as I like to, but I really love doing that. And I also like to do some other social cultural things, like going to the symphony and spending time with family. It's wonderful to be in a group practice like we have here. We had 6 neurosurgeons, and each neurosurgeon has something different to contribute to the group. So when we have a patient that have a problem that one neurosurgeon is better trained to deal with that problem, we can have the patient refer to that specific neurosurgeon within the group, and he'll be able to take care of the needs of that patient better than some other neurosurgeons. And I think that's a great benefit for the patient care.